Lactose intolerance in babies refers to the inability to digest lactose, a sugar found in milk and dairy products, including breast milk and formula. It occurs due to a deficiency of lactase, the enzyme needed to break down lactose in the small intestine. While true lactose intolerance in babies is rare, there are several types to consider. Types of lactose intolerance in babies. 1. Congenital lactase deficiency. Rare genetic condition where babies are born without the ability to produce lactase. Symptoms appear soon after birth and include severe diarrhea, gas, bloating, and failure to thrive. 2. Primary lactase deficiency typically develops later in childhood or adulthood. Rare in infants. 3. Secondary lactase deficiency, temporary condition due to injury or inflammation of the small intestine, for example, from infections, celiac disease, or food allergies. Resolves as the intestine heals. 4. Developmental lactase deficiency. Seen in premature babies because their intestines are not fully developed. Usually resolves as the baby matures. Symptoms of lactose intolerance in babies: watery diarrhea, often frothy or acidic, causing diaper rash. Excessive gas, abdominal pain or bloating. Fussiness or irritability after feeding. Poor weight gain or failure to thrive in severe cases. Diagnosis: hydrogen breath test. Measures hydrogen levels in the breath after lactose ingestion. Stool acidity test checks for lactic acid in the stool, common in undigested lactose. Elimination diet. Removing lactose-containing foods to observe symptom improvement. Management. 1. Breastfed babies. Breastfeeding is usually encouraged as lactose intolerance is rare. If needed, lactase enzyme drops can be added to expressed milk. Consult a pediatrician for guidance. 2. Formula-fed babies. Switch to lactose-free formula or soy-based formula if recommended by a doctor. Hypoallergenic formulas may be needed in cases of multiple food sensitivities. 3. Secondary intolerance. Treat the underlying cause, for example, infection or inflammation. Temporary use of lactose-free feeding options. When to see a doctor: persistent diarrhea, irritability, or poor weight gain. Signs of dehydration: dry mouth, fewer wet diapers, lethargy. If you suspect lactose intolerance in your baby, consult a pediatrician for a proper diagnosis and personalized treatment plan.